I can jump in because I don't think we're expecting a lot of people. This is going to be just some of it you may have heard because I see some familiar faces on here, but I did want to just pull some of this together. So we can advance, Quincy. So it struck me as I've been talking to agents and talking to agencies, FMOs, over the last several months after the release of our Medicare work, that there's kind of this expectation of, okay, we're just going to run headfirst into AEP. We've got all of our tools, and we're just going to, hit the ground. And I think one of the biggest takeaways and one of the things that we wanted to come out of our research is that the interaction with consumers and the interaction with Medicare consumers specifically is not just a Medicare conversation. There's a lot going on at that moment for Medicare consumers, and for agents really to be kind of attacking it with just one angle, they're missing a lot of opportunity, and they're missing a lot of opportunity to bring value to consumers. So what we wanted to do is tie some of these pieces together and start thinking about what that broader value is that agents can bring to the table. And also kind of be realistic about what is being provided today and how it's being consumed today by consumers. So we'll go ahead and jump right in. So choice. There's been some interesting work that's come out of, and you can go to the next slide, the Commonwealth Fund, as well as Kaiser Family Foundation. Lately, Kaiser, does their usual annual surveys of Medicare enrollment by plan type, et cetera. But what I found fairly novel was this from the Commonwealth Fund, where they started to get into the actual choice that consumers had and how that was being presented by agents. So in 2021, an average consumer is going to have access to this many plans. That's a lot of plans to choose from, and it's not always all presented to them in a way that they can really understand the choice. So that's really where the agents come in, right? The agents are coming in to have that conversation with them. But the way that this study, some of the outcome of this study was to look at the tools that agents had at their disposal. And they started to note that the tools themselves weren't complete. Therefore, the agent's knowledge certainly couldn't be complete, and the recommendations that couldn't be complete for a customer. And so when we kind of unwrap some of this, I think one of the big takeaways we have is the support network around agents is not ready really to help, to give them the agency to help consumers in the way they need to. There's just this rapid increase in variety, but not really the tools out there to help agents consume that information and understand it, and then be able to present it to customers in a way that they can make an intelligent choice. And since most Medicare plans are sold through agents, this is going to become a bigger and bigger issue until basically the technology can catch up with what the carriers themselves are putting out there. You can go ahead to the next one. I've been doing a lot of conversation, a lot of interviews and focus groups, bulletin boards with Medicare consumers lately. Their biggest concern, as always, is the cost. And it's almost this crazy fear they have that if they choose the wrong plan going into Medicare, that they have totally messed up the rest of their life. That it's this really turning point in their life, and if they do something wrong, it could basically wipe out all of their savings and destroy the rest of their retirement plans. Of course, you can change a Medicare plan, in a year, but that is not fully understood. And I don't think that consumers really necessarily have internalized that in a way that they can be rational about the decision they're making. And it makes sense, right? Because they're living on $26,000 a year. That's half of Medicare beneficiaries are living on these days. Social Security is only a portion of that. They're spending a good amount of that, almost $6,000 on healthcare and retirement, and half of that's going to premiums. So they're really hyper aware of the costs that are going into this and what kind of an impact that could have on them. If a 10-day stay in the hospital could be out of pocket for a typical Medicare Advantage enrollee, could be $2,000 out of pocket. I mean, you're looking at a significant hit to their annual income. So they really are very aware of these costs, and the agents themselves are not necessarily tooled in a way to make sure that they are seeing the whole range of choices they have to make sure they pick the best plan for them. So we'll keep moving. And this is just another point from our retiree insight survey. Half of retirees feel financially secure. You've got a lot of folks who are pre-retirees who are not feeling that secure yet. So they're entering this decision process really feeling overwhelmed and not ready financially to make that decision. They don't have written healthcare plans in retirement. They don't have written plans for retirement at all. So these are some of the issues that are confronting a consumer during this choice process. And what we found in our research is that agents really aren't prepared to have these conversations. The majority of the agents that we talked to really were not talking about the financial plans in retirement. They weren't talking about other tools people have at their disposal, HSAs, savings accounts that they can use to pay for medical expenses in retirement. They're not talking about financial products with their consumers. And so it's almost a double whammy, right? They're not showing the full range of health insurance plans, and they're not really tooled to have these financial conversations. So a consumer is not necessarily getting the help they need from agents. Moving. So they can provide a significant amount of value when done right. These agents, you can keep moving here, covered this, I think, in multiple places, but there is just a general not well understood. Medicare is not well understood among consumers. We saw this as met with Medicare Sup, especially. I've had a couple conversations with the agencies about this, and they find this very surprising because they say that their agents are usually having this conversation about, what is Medicare? I'm not really sure what this means about Medicare Advantage plans. So I'm not sure quite how to read this, but the fact is that Medicare is not well understood. And so this is definitely one area of value that an agent can bring to the table, just the basics. And this is one area that I think they do fairly well. So you can keep moving.
Edna?
Yeah.
Is the source for that last slide, was that Greenwald or someone else?
That was us, yes.
Okay.
Noted there. That was in this last Medicare survey. Yeah. The biggest value that agents can bring to the table is exactly that. Explain Medicare clearly and simply to people. And over half of the folks in the agent group said this. So these are people 64, 65. And those in Medicare would agree. They all say, that's the number one reason that we use an agent. But there's a lot of other areas where agents can bring value. And so when we gave them this battery to choose from, two others that kind of rose to the top are the knowledge of how to select the right plan for your financial situation. And this includes the ability to do future costs and needs assessments. You've got 45% of folks who are aging in, again, in that 64, 65-year-old category, and they really need help with this. They, some have a financial advisor. I think probably Judy knows this better than anyone on the call. The percentage of folks who have a financial advisor is not that high. And we know financial advisors don't have conversations about health. So we know that these consumers really need the help where we're at the intersection of health and wealth, and they're not getting it from the agent, and they're not going to be getting it from the financial advisor. But it's an area that if an agent can do well and if they have the right tools, then they can really make a big difference, especially at that age-in moment.
I'm sorry to ask another question, but I'm not clear on the legend down there.
The agents versus Medicare Net.
Okay, thank you.
Oh,
Agent?
Age-ins. I'm talking about the 64 to 65-year-olds.
Right, got it.
Yeah. Versus everyone who said they were on a Medicare plan already.
Thank you.
Yeah, no problem. Where an agent can really provide value to the folks who are in Medicare already is having a deep knowledge of carrier products. You see that 29% there for people who are on Medicare. A really big reason why they'll go to an agent is to get that knowledge of the products. And you're going to see in a couple slides, that's not always what is being brought to the table, right? An agent is showing them the products that they know and that they have access to, and not necessarily the full spectrum of carrier products. So we can keep moving. So what are agents talking to clients about? We know what they want. We know what consumers want to hear from agents from that last slide. What do they actually talk to agents about in these meetings? They're talking about prescription drug coverage options. Excellent. We know that's a huge out-of-pocket expense for lots of folks. They're talking about benefits beyond healthcare. They're talking about comparison of doctors and hospitals. This is really an area where an agent will provide a lot of value, because if they can actually identify which hospitals, which doctors are in a particular geographic area or in network, that's going to be very important for any consumer. The next one. But what are they not talking about? They're not talking about how to use HSAs in retirement. They're not talking about long-term care and end-of-life planning. They're not talking about any financial planning aspects or the financial aspects of retirement. These are things that we know from all of our research at Greenwald and that health and wealth connection, that if we don't start connecting the dots for consumers, and we keep having two separate conversations, really, one financial planning for retirement and one health planning for retirement, you're gonna continue having the angst because one very much influences the other. And you're not really preparing the agents either, right? If the agent doesn't think they have to talk about these things, then they're really not bringing the full value to a customer that we would hope that they could. Next one, Quincy. And this is coming through, right? The consumers we spoke to, we asked how many of them are using an agent today. It was just under half, I think it was 44% said that they used an agent for their Medicare insurance renewal for the year or enrollment for the year. And if you go to the next slide. What is the next slide? There we go, yeah. And you've got, 58%, so a little bit over half saying that, it's helpful to have that live person assist them in doing the insurance enrollment. I just gave you another number that's not on the screen, just around half, a little bit less, saying they actually did use an agent. But if you go to the next slide, we see that it's not really even across the board, the types of people using agents. You've got the people who are in Medicare Supplement plans more likely to be using an agent for enrollment than those who are in Advantage plans or in original Medicare or traditional. Keep moving. Women more likely to be using an agent than men. But next slide, okay. But this is really where I think the kicker is. So you're not seeing, a huge percentage of folks using an agent. There's a decent number that are not. And the ones that have been having experiences with their agents, they are indicating that they aren't necessarily the quality of interaction that they would like. You've got only 50% of people in Medicare who say that their agent is high quality. So this is really indicating that, yeah, I'm using one, it's helpful to me to some extent, but there's a big room for improvement here. What those agents could be bringing to the table, the value they could be bringing to those conversations. And I personally, in Greenwald, I think especially would say that extra value that's missing, that's not on the table today, is really in that health and wealth connection. I'll keep moving here. The biggest reason why people do not use an agent when we asked them was because they already knew what they wanted to buy. But this, I think, really kind of covers over an underlying issue of, what I had was good enough. I don't think this agent's really going to tell me anything new or different or better that's going to make me make a better decision. So therefore, I'm going to stick with what's good enough. That inertia in any plan, in any health insurance plan, is something we see, at all ages, not just Medicare. But especially when you're talking about people who do have such a wealth of plans at their disposal, the fact that so many of them just kind of stick with where they are is an indication that they really probably are not having these conversations, what the value is of one plan over another and how they can really make the best planning for retirement. And keep moving. Okay. So agents really do need to do more than just explain Medicare well. They need to be able to have more in-depth conversations, or at the very least, connect the dots for people. And move on. We asked consumers, how often do you want to be talking to your agent? And you've got almost 2/3 of them saying, look, I'm happy to talk to my agent at least one time a year after I enroll. You've got some people who, especially who are in that early stages of retirement planning, haven't done a full job of their own retirement planning well. They're interested in more interactions with a broker or an agent over time. So this is really indicating there's a desire to talk to somebody if they can bring value to the conversation. Keep moving. So what would some of those conversations look like if the agent reached out during the year after enrollment? The number one for half the folks is talk about other offers, life insurance, dental and vision, ancillary products. We can probably think of financial conversations in this mix as well, or at least connecting the dots for them. Other reasons would be more typical sort of marketing interactions as well, marketing and content, current events, tools and applications to manage expenses. What's really interesting to me is this joint financial and health advice session. We got a lot of people saying, or very few people saying this is of interest to them, and yet it also seems like one of the biggest opportunities. So I think this is an area that we would need to reconcile what this intersection of health and wealth looks like. But it's clear that today, not a lot of people think of their health insurance agent as being a point of contact for that. And yet we know they're having conversations about financial aspects of retirement. We know they're talking about prescription drug costs, health costs, the planning costs of healthcare and retirement. These are things that it's information that's being gathered and a real opportunity to leverage it and provide value. It's just not happening. And clearly consumers don't think of it happening right now.
Oh, quick, just thought on that, I guess, or kind of a fragment of a thought.
Yeah.
I'm just wondering what people thought of when they saw that like option. I honestly don't know, but I'm like, are they thinking of something that's like a general session that's kind of like informational that like, or is it something more customized to their specific situation and options? Because I feel like maybe that could, if there was more in some future thing, like broken out, like by some different types of like sessions, or maybe just the word session sounds too like committal, or like they have to commit to some formal time thing as opposed to just hopping on a call and talking about the health and wealth. So part of me is wondering, like, it would just be interesting to kind of like at some point explore more into that.
I would agree. I think that's a very good point. And so I can tell you, like, anecdotally from all the other research we do, people want to have customized tools, right? They really want to have, especially as Medicare folks, they want to have something where they can enter in all their personal data and get shot out. This is the right plan for me, and this is how I'm going to pay for it, or how much it'll cost, right? So personalization, I think, is like for sure would change that. But also, I think you're right. We didn't clarify it because we were kind of leaving it a little bit open. I think we should dig into that our next cycle of this, because it does seem like the area that needs to be addressed the most, right? We hear that health expenses in retirement are one of the biggest concerns people have, paying for long-term care especially. And we know that our agents aren't necessarily having those conversations. So who is having that conversation with them? Do they just have to reach out when they have a long-term care need, right?
Yeah.
So I think that, like, we need to really get into that some more.
Yeah. Thanks. Yeah. Really interesting. This.
And so this actually ties to that, which I found very interesting. We asked agents, where do you get your business from? Thinking maybe they have very extensive referral networks, or you would think they would have extensive referral networks with financial advisors in the area, with bankers, lawyers, accountants, that sort of thing. Really not so much. 36% of them do not use a partner ecosystem at all to get clients in the door. Another 40% get less than 20% of their business from this sort of a professional network, which leads you to think, well, then how much cross-pollination is really happening? How much conversation is really happening for the benefit of the client? If a client comes to you and is afraid about what long-term care costs are going to look like. Are you just selling them an insurance policy, or are you also connecting them with a financial advisor to talk to them about how to pay for that? There seem to be some gaps here that are not necessarily being met, especially by agents. And I did talk to agency about this, an FMO leader, and he said, I think it's because Medicare brokers are too afraid of opening up their books of business and their contacts to other people. They're afraid to lose the business. And so with that, there's this fear of kind of developing a network. So it seems counterintuitive to me. It doesn't seem like the right approach. And it possibly is an area for exploration of how to engage them better and help them develop these ecosystems. Moving. So tools, and I think what my last point goes directly to this. Agents really do need better tools, more training, more support in order to create this environment in which they're providing value to their customers, not just for Medicare, but for all of the other kind of health and wealth considerations that they know their clients are facing during retirement. We know they turn to FMOs for this. A good portion of them have at least 2 to 3 FMOs that they're appointed through. They are doing so because they want access to a larger selection of Medicare insurance products. But are they reaping the benefits of an FMO? An FMO is also there to help facilitate these connections and provide these tools and education. And this, I think, is really at the heart of what we are suggesting. Keep moving. That FMOs and to some extent carriers, because we know that carriers are also looked to for some of these items, they really, to the extent that they can step up and provide resources to agents to be these real centers of influence for consumers, the better off everyone will be. So it's not just having an access to a larger selection of Medicare insurance products. Why else are people going to FMOs? Because they need business support help, they need perspective and expertise on different product lines. They also need those personal relationships. So they're working with all these different people, but you see near the bottom of the list here is access to different product training. There's not really a big appetite from the agents that we talk to, at least, to have different product training. And yet we see that customers would like to talk to them about other products. We know from other research that customers need help in deciding on long-term care products and final expense and hospital indemnity and all of these other things. And it does seem like the natural person to be doing that is the insurance agent. Keep moving. Another, one of the major reasons agents say they want to work with multiple FMOs and carriers is to have marketing support. But what does marketing support mean to them? A big piece of it is plan comparison tools. And so this, we can see, there's an attempt by agents to try to get their arms around all of the different products that they have available to them and that their clients have available to them. But these product comparison tools are not complete. They're not showing all the different plans in the area. And to the extent that they don't, the agents don't have those tools at their disposal. So we know that, agents need these tools. They're being given partial tools. But even the most basic kind of goal of an agent to provide assistance in Medicare enrollment, even that is not fully equipped or fully tooled for them. And then obviously all of these other sorts of tools of showing networking support, helping them have better technology, helping them really become that center of influence for a consumer, those tools aren't really available to those agents either. So you can go to one more slide. I think this is it. And so going back to that Commonwealth Fund article, they did do an analysis of plan comparison tools out there, Medicare plan comparison tools. And somewhat shockingly, a typical online comparison tool has maybe 2 of the 5 Medicare Advantage plans available in this specific area. They're maybe showing 2 of 3 Medicare prescription drug plans that are available. And they're showing less than 1 in 5. Only 1 tool actually even had Medicare supplement plans listed within it for a certain geographic area. So when you think about that, and you think about this is the best support that an agent has on the road to have conversations. There really are a lot of gaps. So there we go. that is that. And I think we're just at time. Any other thoughts or questions? I know Matt Greenwald on our end is working on trying to develop some ideas to test about tools that maybe the health and wealth connection could be made more clear. He's reaching out to a lot of his contacts on that. If you have an interest in that or are already working on something, that might be interesting to connect with Matt about. Because I think that that health wealth connection is the next gen, if you will, of agents and Medicare agents to really be able to tie some of these loose ends together and not just talk about Medicare in a comprehensive way, but also talk about the rest of the needs that retirees have.